The news day continues here on One News Now. I'm Jess De Los Santos. Here are some of the latest updates from the Health Department. The agency again urged everyone to observe minimum health standards as variant cases continue to increase in the country. Around 700 cases of variants of concern have been recorded, including the B117 variant first detected in the UK, the B1351 from South Africa, and P1 from Brazil. Meanwhile, 123 new cases of the P3 variant first detected here in the Philippines have been logged. As of now, the P3 variant is still not considered a variant of concern according to the DOH. The Health Department now reiterates the need to adhere to health protocols and calls for increased support for the country's vaccination programs. Health officials denied claims that it was the COVID-19 vaccine that caused the stroke of a 54-year-old vaccine recipient in Caloocan. In a statement, the DOH said that the regional adverse events following immunization committee did not find any correlation between the vaccine and the incidence of stroke. They said the timing of vaccination was simply coincidental to the underlying or emerging conditions of the patient. The DOH and the FDA reminded all vaccination sites to strictly follow screening protocols and urged the public to fully disclose their underlying conditions before receiving the jabs. The Health Department is now investigating COVID-19 testing laboratories that closed their operations during the Holy Week. In yesterday's Laging Handa briefing, DOH Undersecretary Maria Rosario Vergere said that the department has already sent letters to various laboratories asking them to explain why they did not follow the department's mandate to stay open during the holidays. Vergere stressed that all COVID-19 testing facilities must remain open at all times.
Tayo ay nagpapaalala uli sa ating laboratories na kailangan bukas tayo kahit holiday and weekend, this time na mataas po ang ating mga kaso.
The Philippines has called on Myanmar to uphold the ASEAN Human Rights Declaration, including the principles of democracy, the rule of law, and the respect for human rights. The ASEAN Intergovernmental Commission on Human Rights, Philippines, and other member states expressed concerns over the recent violent developments in Myanmar. The group urges Myanmar to adhere to the principles enshrined in the ASEAN Charter and its Human Rights Declaration. Anti-coup protesters in Myanmar continue to gather to demonstrate against the military junta despite its claims that a protest campaign against its rule was dwindling. And here are the stories happening from around the world. Myanmar security forces fired rifle grenades at protesters in the town of Bago, killing more than 80 demonstrators yesterday. The Assistance Association for Political Prisoners said 82 people were killed during the protest against the military coup that took place on February 1st. Local media said that the firing started before dawn on Friday and continued into the afternoon, leaving corpses piled up in a harrowing scene witnessed by reporters and civilian witnesses. Iran has entered another 10-day lockdown to address the fourth wave of COVID-19 in the country. The lockdown affects 23 provinces in Iran. Businesses, schools, theaters, and sports facilities were shut down, and mass gatherings are banned throughout the holy fasting month of Ramadan, which will start on Wednesday. COVID-19 cases in Iran surpassed the 2 million mark, with a new daily average of over 20,000 infections over the past week. In Israel, a study found that the South African variant of SARS-CoV-2 can break through Pfizer's COVID-19 vaccine. Reuters reports that a little over 5% of 400 people studied who had been vaccinated twice with the Pfizer jab had become infected with the B1351 variant. This is 8 times higher than the infection rate of those unvaccinated. This suggests that the vaccine is less effective against the South African variant than against the original coronavirus that had started the pandemic. But researchers admitted they were only able to conduct this study on a small sample size, as the South African variant is not that prevalent in Israel. Currently, around 53% of Israel's 9.3 million population have received both doses of the Pfizer vaccine. With a worldwide uptick in COVID-19 cases, health experts are now warning people about the risks of what they may think are casual interactions with other people. Meanwhile, a researcher from Johns Hopkins expressed grave concern for countries who are slower than the U.S. in rolling out their vaccines. This report from Bloomberg tells us why.
Well, it's less about density and it's more about the interactions you have. So obviously in dense places, you're more likely to come in contact with people. But I think increasingly we're finding that it's not just these casual interactions. It's really, sitting inside of a restaurant with somebody that's not inside of your family without your masks on. Really crowded indoor spaces are our biggest worry.
What about crowded outdoor spaces, including 38,000 watching the Texas Rangers a few days ago?
Yeah, so that's not great. I mean, outdoor spaces are generally safer, but when you pack people right next to each other and they're sitting there for a long time, basically breathing and yelling in each other's faces, that's really high risk for transmission.
So is a concern here that the more people who get infected in the United States, especially with the new variant, the higher the threshold to reach some sort of herd immunity, that more of the population has to be inoculated?
Well, the concern here is just that we have vaccines now that can prevent people from, getting sick. And so at this point, anybody who gets sick and worse, anybody who's hospitalized from this virus, I mean, it's a particular tragedy because we know now that this is a vaccine preventable illness. So we'd like people to not get sick until we can reach them with a vaccine. So that's really the urgency here. We're going to reach some level of immunity either through the natural infections that people are experiencing or the vaccine. I would really prefer the vaccine because each additional person that gets sick, there's a probability that we could have additional loss of life.
There's a sense that things are going to get better. The pandemic will end. It is sort of just the path there, as you say. I do wonder, though, how much some of the turmoil around the AstraZeneca vaccine slows the progress of getting to the end of the pandemic. Do you have a sense of that?
Yeah, I'm really worried about that. I mean, I think here in the United States, we're in much better circumstances. We've been rolling out vaccines really quickly, and we're not dependent on AstraZeneca at this point. But other countries are wholly dependent on it. So the fact that there are, supply issues in terms of countries preventing exports, as well as, perhaps countries being not willing to use the vaccine because of some of the recent safety concerns. In my view, the safety concerns have to be balanced against the risk of infection, which at this point globally is very high. So I'm worried about that. I mean, we need all resources on the table right now to bring this pandemic to an end. I think the United States is on a good trajectory. We could do better with the rise in cases that we're seeing in some parts of the U.S. But overall, I think we're looking much better than other parts of the world. And I do really worry about those places that are quite delayed in their vaccination campaigns.
And those are the top stories of the hour. Join us later at 1 p.m. as we continue to monitor the day's biggest stories. You can also catch One News on the Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Jess De Los Santos. We are One News.